Hi, Michael Wildenstein with Foot Pro Informational Series. We have another horse for us to work on, and we're going to go through the information that we need to help us leave this horse off better when we go than when we came. First, we need a little information, and the information we'll get is about the horse, the owner's expectations, any issues that might be of concern to the person taking care of this horse, and what the horse does for a living. Do you have any concerns?
Mainly the twing out on the horse on his right front. He's a thoroughbred quarter horse cross. Used to jump him some, but wasn't very good at it. And then they made him into an English pleasure horse. This flat horse is what he's doing now. Doesn't have any very unsound issues. So that's about all I know about the horse. I mean, I shot him.
So you said he did some jumping. What's he do now? Just flat classes?
Just flat classes,
right.
Yes.
And what level?
It's just a quarter horse show, so they do the English pleasure. Is about it.
Sure. And expectations? You going back to jumping, or?
No, just he's still going to remain just a flat horse.
All right. It's a big horse, beautiful horse. While I'm walking around the horse, I'm going to connect with the horse, talk to the horse, allow the horse to get to know me. I want to watch the horse walk. The most important walk is out of the stall or the first few steps out of the trailer. That tells you a lot. You're looking for any gait deviations, any lameness situations. All too often we as farriers are so busy that we just go up to the horses and pick up hooves and go to town shoeing them. It's very important to evaluate the horse. Evaluate the horse, how the horse is walking, any lameness situations or gait deviations. So if we could just take a short walk and away from me and then towards me. And while the horse is walking, I'm looking at footfall. I'm listening to footfall. I'm watching if there's any deviations, any lameness situation, head bobbing, hip dropping. If the ears go back when the horse turns, and it's a good idea to turn them both ways if you have that opportunity. All of the information I put together and try to define what I can do to help this horse out, and I'm going to do this every time I go to trim the horse or apply shoes, because changes occur in the life of the horse, as they do with us, and with the pathologies or injuries or soreness issues that may be going on. We just step up one more. Then I'm going to take a walk around the horse. I'm going to walk around and just look. And remember that the horse is not always standing at attention before defining exactly what you're seeing in conformation. Walk around both sides, because it may look different from one side than from the other. And what I'm looking for is conformational deviations that may influence the way the horse goes, or what I'm going to do as far as the shoes are concerned, any modifications that I may make in them. And the deviations that I'm looking for are flexural. Flexural would include the stance of the legs in this lateral situation. This horse is very straight through here and very straight through the fetlock pastern. Those horses are susceptible to concussive injuries or arthritic injuries over time, especially if they're doing hard work on hard ground or jumping. And that may influence what I do with the shoes. I may define a different style of shoe, a different material, maybe a cushion between the shoe and the hoof if the ground is hard. So a horse that's upright is a flexural deviation. If they're back at the knee is pushed back, that's a flexural deviation, or over at the knee. If he's, if we look at him from the side and the back, if the metatarsals down here go forward, they're a little sickle-hocked, and I may want to extend the shoes a little more to help that out. And in some breeds, these conformational deviations are completely normal. They're bred that way because of a particular discipline. We'll walk around when you're seeing color like this, be a little careful because our eyes are always going to be attracted to that. So if you find something, it would usually be in that limbs. Take that into consideration. I'm looking at the angle of the fetlock, the angle of the pastern, the angle of the hooves. We're not criticizing, we're just evaluating. We need this information to enable us to better shoe this horse. So I've looked at for any flexural deviations. Now I'm going to look for angular deviations. And an angular deviation is a bend. So when I pick these limbs up, I'm going to look down the limb in the natural range of motion. So if I look from the carpus of the knee here and follow down through the cannon bone to the fetlock, and then from the fetlock down to the hoof head, and it appears that this goes in a little bit, completely within normal ranges, maybe just a little bit of rotation down here low in the coffin joint, pastern joint, and axial rotation towards the inside. Not to be critical, just to define conformational deviations. And we'll pull that foot forward because we may get a completely different view of that. Would it be best if we turned around? If we...
Or at least turning.
Sideways.
So again, I'm going to pick that limb up in the natural range of motion. Just let it hang off of my hand, and I'm going to follow my eye down through here from the knee, down through the fetlock, into the pastern, and down into the hoof. And when we look from this direction, we can see it goes in a little bit at the fetlock, but there's a rotation that appears to be out from this point. But if we look up the whole limb, we can see right from the carpus or the knee, the whole limb twists just a little bit out. So that's an abaxial rotation, or we define it as toeing out. So we defined an axial rotation when we had it underneath the body going in. When we stand and watch the animal here, it's abaxial, it goes out, and predominantly abaxial. And if we look at him from the side, anytime the cannon bone goes forward from the knee, he's a little back at the knee. This puts a lot of compressive stress on the front of the knee, a lot of elongation stress on the soft tissues. So compression of the joints here, elongation of the soft tissues on the back of the limb. Well, things to take into consideration. So a horse with that conformational deviation, it's necessary to make sure that the hoof pastern access is as accurate as you can get it, and to ease breakover. On the left fore here, we follow down this limb. You see even a greater fetlock varus, or he goes in more at the fetlock there. We also notice that the hoof is in poor condition. This poses a situation with the farrier where it becomes difficult to find a stable place to put nails and the ability to hold that shoe on there. I guess we'll have to turn around again. And then when I pick this limb up, hold it in the natural range of motion underneath the body. I'm looking at heel length here. This appears to be a little longer than this side. I'm looking at the rotational deviation, axial rotational deviation down low here. The fetlock varus, the horse goes in from the fetlock. And when I'm holding that limb up, I'm feeling the joint, flexing the joint to see how much flexibility we have, if there's any restrictions, any pain. I'm using all of my senses when I'm working on a horse. I'm using sight, I'm feeling, I'm smelling. There's a little fungal issue here, I can smell that. And I'm hearing, when the horse is walking, I'm hearing the footfall as I'm watching the horse. And we'll move on to the hind limb. Going down the limb, let the horse know that you're there. I'm going to cup the solar surface and feel the horse's stress there. They'll usually give just one little resistance, and then I'm going to walk underneath the limb feeling the resistance and hold it up here. Just let that drop down naturally. I can see the fetlock varus, this heel pushed up relatively high, also somewhat of an axial rotation here on this hind foot, completely within the natural range. None of these horses have grown up like the pictures we see in our textbooks. They most all have some form of conformational deviation, and they're either within normal ranges for their discipline or for the activity that's presented to them, or they're not. A lot of horses that have limbs that aren't exactly straight, they do very well. I'm not being critical, I'm just defining the deviations to help me to better shoe this horse. Feel the difference between this limb and the other limb. There's more resistance here. The horse wants to go a little closer. It's all important information. I'm following my eye down this limb. I see the fetlock varus. I'm looking at the height of the heels. And all of this changes the hoof over time at the end of a shoeing period. I'm not being critical. I'm defining exactly what I have to do, and the growth rate is completely normal there. I'm also looking for wear in the bottom of the shoe. How much wear do you have on this side or down here compared to the other side? Because the wear is an indication as to how that horse is landing or going, and it's important information. This horse is wearing a little harder on the lateral or outside toe quarter. Completely normal for a horse that's base narrow. That means that its hooves are closer at the bottom than where it comes out, and this is a very tall, narrow horse anyway. And then I can take the hooves forward and evaluate them in the natural range of motion going forward. And then when I hold this limb in this direction, you can see the deviation there. Fetlock varus goes in from the fetlock completely normal for this type of horse in the discipline it's in. And I'm going to compare it with the contralateral limb. Alright, I may also notice areas of inflammation and just push on that to see how hard or soft it is. I'm not diagnosing, I'm just visualizing. On this horse, he's very tall, so it's difficult to see, but looking down the back, you can see if you have a difference in musculature. Also feeling the musculature helps you define. If there's one side that's very small compared to the other, and atrophy from disuse, it's important information. And remember that the horse should be as square as possible, and look at them and re-look at them, because it may vary from 1 minute to the next. After I've done that, I may have to stand on something to look down the back of this horse. Then I'm going to stand and look at the shoulders. I'm going to look at the biceps and to see if there's any deviation in the musculature of the horse. See how he's standing. Remember if they're relaxed, or even if you stand holding the horse on one side compared to the other, or just push them, that's going to change that. In this horse, I see a little less musculature over here than I see on this side. It could be that the horse is just dominant in this left front, or it could be that there's some subtle lameness in this right. It's important information because this horse may have a difference in its gait because of that atrophy. I'm also looking at the height of the knees, the angles of the fetlock, The size of the hoof head, are they similar? Is one smaller? The angle of the heels, is one more upright than the other? This heel tends to be more upright than that heel. If a hoof is more upright, that's an indication that that horse doesn't have as long of a stride on that side. All right, and because this horse has a fetlock varus here, meaning it goes in from the fetlock, more so on the left front and right hind, that means that that limb is traveling closer to this one when the horse is moving, and the horse would have a greater tendency to pull this shoe if there was excess heel.